Welcome to Thursday's edition of COVID-19. Our daily tally remains on the 600 level amid sporadic cluster infections nationwide. Also, concerns are mounting over the spread of the Delta variant worldwide, and we have details on that later on. Here first are the pandemic updates with our Kwon So-ah. Now, so let's begin here on the local front then.
Let's do that, Sunny. We've got a slight decline in infections this Thursday, but still in the 600s. 610 cases were reported as of 12 a.m. And with that, we've got 576 domestic transmissions and 34 imported cases. And the total number of infections, we'll take a look in a bit. But here we are seeing the numbers are fluctuating between the 300s and the 600s in the past week. And with that, the accumulated figure in the nation stands at 153,155, with 2,008 total fatalities linked to the coronavirus. Now, in the capital region here in Seoul, we are seeing 252 infections, which is the highest figure in 19 days. Also a triple-digit figure in Gyeonggi-do province, while between 20 and 30 cases are reported in many southeastern parts of the country. Now, as part of the government's aim, meanwhile, to get citizens back to their normal lives, the Education Ministry this Thursday unveiled its plan of returning university students back to their classrooms. Here's more from Education Minister Yoo Eun-hye.
First off, we'll be expanding in-person vocational classes that are smaller in scale. The Education Ministry will also broaden the resumption of in-person classes at technical colleges so that students can return to their classrooms in September, as vocational classes make up around 69% of the curriculum at these schools.
Universities can, however, make their own decisions, as it appears that some, including students themselves, actually prefer online classes amid the COVID-19 situation. The reason for a return to in-person classes in stages, meanwhile, different from getting all students at elementary, middle, and high schools back to school in the second semester, is due to university students having more exposure and activities in the society, and people in their 20s make up 15% of COVID-19 infections. The government is expected to make a further assessment on expanding in-person classes according to the third quarter vaccination result, meaning whether 36 million people have been inoculated with at least one dose by the end of September. And as of this Thursday, we are seeing 15.1 million people who have received that one dose, and also 4.4 million people that have been fully vaccinated.
I see. Right, so let's now touch upon global concerns over the Delta variant.
Yes, Sunny. First off, in the U.S., top infectious disease expert Anthony Fauci said he expects the Delta variant to become the dominant strain in the U.S. in the coming weeks or a month. And the European Center for Disease Prevention and Control says in Europe, the Delta variant could reach 90% of total infections by the end of August. And also, here we can see Indonesia here is struggling with the Delta variant. So let's take a closer look at the daily figures here. Indonesia saw over 15,000 new infections in the past 24 hours as of noon Korea time. Similar daily increase in the UK, and that's 4,000 more cases than the day before. And here in Brazil, really serious concern, a 6-digit figure of new daily infections, more than 114,000, while Colombia has just hit the 4 million mark in total infections. And around the world, we now have over 180 million cases. And those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for now. Right, now for a closer look at the spread of variants here on the local front, I have our Lee Kyung-eun in the studio with me. Welcome, Kyung-eun.
Hi, Sunny.
Right then, Kyung-eun, let's start with the government's assessment of variant cases here at home.
Well, more than 2,000 cases of COVID variants have been detected here in the country so far. Among them, the Alpha variant, first detected in the UK, accounts for roughly 85%. The Delta variant, first identified in India, accounts for roughly 11%. The Beta variant from South Africa is at about 6%. The Brazilian variant is the least prevalent, with only 7 cases having been reported so far. Authorities say these variants pose a serious threat to their containment efforts. But on a brighter note, they added that the spread of the variants here is not as serious as it is in other countries.
Variants account for roughly 40% of all the samples we've analyzed recently, which is lower than in other countries.
Of those variants, the most concerning is the Delta variant. It is known to be 70% more contagious and has more than double the risk of hospitalization compared to the Alpha variant. It has so far been detected in more than 80 countries. In the UK, it has become the dominant strain there and accounts for a staggering 90% of all recent cases. It's fast spreading in the U.S. too, responsible for nearly 20% of the country's new infections. Compared to that, Korea has reported 190 cases of the Delta variant, which is relatively fewer, but that's no reason to let our guards down.
Indeed, Kyung-eun. So how are authorities here better preparing for the threat ahead?
Well, the government is now ruling out the possibility of the Delta variant taking dominance here in the country too, but they remain confident that the virus can be contained with the help of vaccines. They say current vaccines are proven to be effective against the Delta variant, according to what they have witnessed in other countries. Health authorities previously said the Pfizer vaccine is 88% effective against Delta variant, while the AstraZeneca vaccine provides 60% protection. They reassured the public that Korea is capable of handling any contingencies in regards to the spread of variants, saying the country's healthcare system is well equipped to handle a spike in various variant cases.
We cannot rule out the possibility of the variant continuing to spread, so we're trying to free up as many hospital beds as possible. Right now, some 2/3 of our beds are available, which is enough to handle a spike in variant cases should that occur.
Authorities also pointed out that vaccines can significantly lower the rate of serious illness and deaths, even if cases were to rise. This especially rings true for elderly citizens over the age of 60 in the country, most of whom have been vaccinated.
Right, and meanwhile on the academic front, what efforts, Kyung-eun, are in the works to protect those who are preparing for their college entrance examinations later this month?
Well, the government is trying to make sure anyone who's taking the national college exam in November is vaccinated. They include high school seniors and those who are retaking the exam. The plan is to vaccinate them before the mock exams in September, ahead of the actual test date in November. This is why the government has designated high school seniors and teachers, test takers, and along with teachers, as a top priority group for the third quarter inoculation campaign.
By vaccinating teachers, we'll start the country's journey back to normalcy in earnest, starting with our schools. We will also vaccinate test takers to help them prepare for their college entrance exams.
Seniors and teachers in high school will be receiving Pfizer vaccines starting on the third week of July. Those retaking the exam will also be getting Pfizer shots, but a little later, starting in August. Because those signing up for the mock exam in September will be eligible to get the first shots in the third quarter, there are concerns that some may register just to get vaccinated when they have no interest in taking the mock exam. But the Education Ministry has brushed the worries, saying the rest of the adult population between the ages of 18 and 59 will be able to get their shots soon enough in August. This means they won't need to register for a mock exam under false pretenses, just so that they can get the shots a few days or weeks earlier.
I see. Right, Kyung-eun, let me just correct myself. The college entrance examinations are slated for later this year and not this month, as I said earlier.
Yeah.
All right, Kyung-eun, thank you very much for that coverage.
Thank you for having me.
Right, it's time now for the regular afternoon briefing on the COVID-19 situation here in Korea for this Thursday. And while we wait for that to start, here's a look at the revised framework of social distancing guidelines, which are slated to go into effect starting July. Well, I have been told the briefing will start, but while we wait for that, the briefing's about to start. We'll come back to you afterwards.
Let us now begin our regular briefing for June 24th, Thursday. First of all, on the vaccination front, here are some updates. As of today midnight, we have been receiving, those who have been receiving the first dose, numbers at about 15,150,121, which is about 29.5% of the total population. And we have about 4,413,000 people who have been fully immunized, which is about 8.16% of the population. And also at nursing hospitals, we have about 69% finished inoculations. And at nursing homes and care centers, we also have about over 50% of the inoculation complete. And right now, we are currently rolling out the vaccines for the second dose. And to this end, in order to protect yourself from the new variants and also to have immunity against COVID-19, it is very important that you are fully immunized. And as of those between the ages of 60 and 74, and also those who have chronic respiratory diseases, those who have not been able to receive the AstraZeneca vaccines, despite having signed up for their early vaccination appointments, we are beginning another round of our early registration for Pfizer vaccines. And this continues until the 6 p.m. of the 30th of June, and you could also do so through the web page and call centers as well. And as for the call center, we advise you to book your appointments via our homepage in order to enhance convenience. And right now, we are planning to roll out the Pfizer vaccines starting from the 5th of July at designated vaccination centers nationwide. And as of vaccine supply, the Moderna vaccines, we have the second batch to be arrived soon, and we also have about 55,000 of them to be arrived very soon. And we have also finished the supply of more than 17 million thousand. And also in these the latter part of this month, we also have more Pfizer vaccines which are ready to arrive here in Korea. And also in the latter half, we plan to have about 80 million doses of the vaccine to arrive. And as for the details, we will be disclosing any updates depending on the negotiations by each of the drug makers. And as of the surplus vaccines, starting from the 27th of May, we have been rolling out the first dose vaccines. And through these Kakao and also Naver platforms, we have been receiving these surplus vaccine sign-up. And we have seen that about 200,000 people have also signed up and received such surplus vaccines, and about 2.7% of the entire inoculated people have also account for these recipient of the surplus vaccines. And after the 2-week pilot run of such program through SNS and other platforms, we have seen an increase in the number of people signing up for these surplus vaccines. And also here are some updates on our outbreak here in Korea. Our daily tally hovers around 600, and lately we are seeing cluster infections breaking out at multi-use facilities, including religious centers, as well as restaurants and cram schools. And this is why it is very important that we continue to exert a sense of vigilance. And during the past week, we have seen that about 11% were related to the cluster infections of multi-use facilities, and they accounted for about 300 cases. And as for the cram schools, we have seen that one index case has had a delay in identifying his or her diagnosis, and there was also weak ventilation, and also non-proper wearing of face masks were pointed out as some of the risks. And as for the workers and managers at these multi-use facilities, we ask you to also ventilate these premises on a regular basis before these courses begin for the people. And also we ask you to refrain from going to these places if you have any clinical symptoms of COVID-19. And also you need to wear face mask and also practice other personal hygiene measures. And lately at the places of worship, we are seeing an increased trend of these cluster infections, which is also spreading to local community transfers. And as for the religious centers, we have seen that after regular services, they had group meals, or they also had small group meetings, and also they had a lack of proper face mask wearing. And in order to ensure the safe environment at places of worship, it is very important that you keep the attendance cap and also have social distancing measures. And also please wear your face mask at all times when you are at such facilities, and also refrain from having group meals or having small group gatherings. And as for imported cases, on a global level, we are seeing a downward trend of the new cases on the 7th consecutive week. However, in certain countries, we are seeing a spread of these and a resurgence of the virus due to an increase in the spread of these new variants, especially the Delta variant. And also these cases are very serious in UK and Moscow, and also 90% of the new cases in Moscow especially were the Delta variant, and the same was also true for UK as well. And to this end, we are also seeing an increase in the global vaccination rate. However, we are also very much concerned of the rapid spread of these new variants globally. And to this end, we once again highlight the importance of vaccination here at home as well. And on a global level, we are seeing a very fast spread of the Delta variant. And here in South Korea, we are also exerting our full efforts to stop and contain the further influx of these imported cases. And right now, we have 190 Delta cases, and 3 of them were local transmissions. And we see that we are at the initial stages of a widespread influx of these cases. And all of the foreign travelers and all of the travelers, incoming travelers from abroad are mandated to submit a PCR negative document. And as for the public good purposes, or also those who are visiting Korea for business purposes, we are also having them exempted from the mandatory quarantine. And we will be also exempting the foreign, people who are also flying in from other countries when they come to Korea to visit their immediate family members starting from July. And to this end, we will be bolstering our quarantine measures and also increase our level of monitoring of these local spread of these new variants in order to further contain the virus. And starting from July, we will have been introducing the new revamped social distancing scheme, and we also will be expanding our vaccination drive to include more members of the general public. And we also have the summer holidays and summer vacation coming up as well, and though we have also higher risks of infection. And please note that we are also having very many silent infections as well. And here in South Korea, our rate of those who have been fully immunized stand only at 8.6%. And with their only single dose, we cannot become complacent, and also we cannot let our guards down as of right now, because we only have our high-risk group receiving the first dose only. And to this end, it is very important to practice social distancing measures and other quarantine measures until the high-risk groups are fully vaccinated with the second dose as well. So we ask you to continue to exert a sense of public vigilance. And if you have any clinical symptoms of COVID-19 like fever, we ask you to get tested as soon as possible. In particular, as for the recipients of the vaccines, if you have any clinical symptoms of COVID-19, you need to get tested as well. And in order to overcome COVID-19 and return to our pre-pandemic routine, it is very important that we keep to our basic quarantine routine and also vaccinate ourselves. And it is very much important for the months of July and August. We need to also practice the wearing of face masks at all times, regardless of where you are. And you also need to get tested if you have symptoms and continue to comply with basic quarantine rules. The quarantine authorities will also exert our full efforts to contain the influx influx of and the spread of the new variants here in Korea and be fully prepared for the inoculation drive. Thank you very much.
Right, there was Chung Young with Thursday's afternoon briefing. So what did she have to say?
Chung stressed that we should not lose our guards right now at this point, although infections worldly have been seeing a decline, but especially because there's a high risk of the Delta variant. And also, she mentioned that there were some, especially cluster infections breaking out at a number of venues, such as singing rooms, religious facilities, restaurants, and cram schools. And at those cram schools, she called on staff to make sure that there's proper ventilation before and after classes. And there was also some interesting updates regarding the number of people who got vaccinated through surplus of vaccines, and that through applying through mobile and online applications, for instance. And there were 250,000 who have been vaccinated through those surplus vaccines. So around 2.7% have applied through these SNS. And that's 46% of those were in their 40s and 42% in their 30s. And yes, Chung also stressed that the revised social distancing system will start with the beginning of July, and also summer vacation is coming up, which means we should still be careful as we just have some over 8% of the nation's population that is fully vaccinated.
Right. All right, so thank you very much for that.
Thank you.
Right, COVID-19 restrictions indoors have prompted more people outdoors to hiking trails nationwide, but the popularity of this pastime is also leading to greater litter. Accordingly, a campaign is now underway here to better address this waste problem. To take a look.
Here is Bukhansan Mountain, one of Seoul's representative national park. Since the pandemic, the number of visitors to the park has increased by more than 1 million. At the same time, however, the amount of waste also increased by 10% during the same period. As a solution to this problem, various environmental movements such as plogging and clean hiking are going viral among young people.
The so-called clean hiking has gained much popularity as it not only allows you to stay healthy but also protects the environment. Today, I am at Bukhansan Mountain for the hiking, and these are the items you need to have for a clean hiking checklist. First, you need to have hiking wear, and you need a bottled water, you need a trash tongue and trash bag. And now clean hikers are right over here, and with them, let's go hiking.
This group is the clean hikers for the day. Clean hiking originally began with a small group. However, as the amount of trash on mountains has increased since the pandemic, this group began recruiting volunteers on a rolling basis.
클린 하이커스는요, 산에서 버려진 쓰레기를 줍는 것을 시작으로 조금 더 환경적으로 메시지를 전할 수 있는 많은 일들을 하는 그런 그룹이라고 하면 될 것 같아요.
Anyone who loves the environment can join. Warming up before hiking is a must. It is important to warm up enough for a safe hike. The National Park Office is also trying to reduce waste from mountains. And as part of its efforts to do so, eco-friendly lunchboxes are being sold at the National Park. Lunchboxes can be reused as these do not use disposable products.
친환경 도시락을 드시고 난 후 발생하는 용기는 관련 업체에서 다시 수거를 해 가고 있기 때문에 현장에서 발생할 수 있는 쓰레기량이 크게 감소하는 효과가 있습니다. 이러한 서비스는 국립공원 지역 내 재활용 쓰레기를 저감시키고 그리고 더 나아가 사회적 기업 등 지역 경제 활성화를 위한 큰 목적이 있다고 볼 수 있는 공단 정책 하나입니다.
Clean hikers picked up trash that's left on the trail. In fact, trash was everywhere. They dug out trash buried underneath the ground and even removed the trash stuck between the stones. We also could see discarded masks.
대체적으로 쓰레기 양이 많아졌어요. 왜냐하면 코로나 시대에 실내 활동이 이렇게 못하게 돼서 많은 사람들이 자연적으로 찾고 있거든요. 그래서 전체적으로 쓰레기 양도 많아졌지만 이전에는 없었던 마스크라든지 쉽게 접근해서 버리는 쓰레기들, 일회용 뭐 커피 컵이라든지 이렇게 간식거리 같은 거 버려진 게 되게 많고요.
Clean hikers' activities indeed are a positive influence on others.
젊으신 분들 좋은 일 하는 것 같아서 너무 보기 좋았고 이제 저도 이제 쓰레기 있을 때 조금 더 주의해서 버리지 않고 집에 가져가는 거 뭐 당연하고 좀 있으면 좀 주워야겠다 생각이 드는 것 같아요. 네.
After 2 hours of hiking, we collected all the trash we picked up from the mountain.
대략적으로 한 사람당 1kg에서 한 2kg, 많이는 3, 4kg 이렇게 줍고요. 오늘 같은 이 도봉산 코스 같은 경우는 그래도 관리가 잘 돼 있어서 쓰레기가 그렇게 많은 편은 아닌데
This mountain was well managed though. There were tons of trash and garbage outside hiking trails. How do clean hikers feel about today's hiking?
그냥 산행할 때보다는 더 소통하고 웃을 거리도 많고 진짜 재밌게 산행할 수 있는 방법이 하나 새로 생긴 것 같아서 개인적으로 되게 재밌어요.
자리에 이제 흔적을 만들지 말아야 되는데 그거를 지키지 못하니까 저희 같은 젊은이들도 더 늘어나야 될 것 같아요.
Finally, the collection of picked up trash is turning into art. She got this idea after thinking about how to send out a message about taking better care of nature.
언젠가는 좀 코로나가 풀리고 그러면 전 국민이 동참할 수 있는 전국 쓰레기 줍기 대회 같은 거를 기획해서 가족들도 참여하고 친구들도 참여하고 연인들도 참여하면서 자연도 즐기고 쓰레기도 줍고 그거를 또 인증하고 이렇게 재밌게 놀 수 있는 그런 자리를 한번 만들어 보고 싶습니다.
Leave no trace. This is the message that clean hikers are sending to all.
So the 2 things that I realized today. First, I could really lose weight through this. And second, it is such a meaningful activity in a way that we made the planet so much cleaner. So the takeaway of the day is this. Pick up your own trash whenever possible and also reduce the use of unnecessary single-use items. Remember, your small changes will make a huge difference. This has been 신세병.
델타형 변이의 국내 검출률은 1.9% 수준이지만 해외 유입의 경우 검출률은 37.0%로 높습니다.
A coronavirus variant first identified in India is looking to challenge containment efforts across the globe as it replaces existing strains. Now, for more on this, I have Professor Chung Gi-seok from Hallym University. It is good to see you again, Professor Chung.
Thank you for inviting me.
And I also have Dr. Shikta Das at University College London, who is joining this talk virtually. Pleasure to have you with us again, Dr. Das.
Thank you for inviting me as well. Nice to see you.
Right. Professor Chung, we'll start here in the studio. As of earlier this week, the Delta variant has been reported in more than 90 countries, and the global health body claims it is faster and fitter than its counterparts. Now, is it on track to becoming the dominant strain?
Yeah, I suppose so, because the transmission rate of Delta variant is higher, 60% higher compared to Alpha variant. then the Alpha variant is already 70% higher compared to ordinary viruses, non-variant viruses. So it sums up more than 2 times higher transmission rate compared to a wild type. So it's very serious one. Another one is the admission rate due to a Delta virus is 2.3 times higher than the Alpha virus. Alpha is already very transmissible. So it is true that including UK, Portugal, other European countries, and then including Russia, India, and surrounding countries, Delta variant has already become a predominant one. So I think it's a matter of time to get to Delta to be the very predominant one. And in US, it is 21% of whole virus, but just 2 weeks ago, that's below 10%. So 2 times higher in 2 weeks' time. So Delta is definitely becoming a very dominant one in the world. And the vaccination rate, whole world, is just 10%. So in other words, 90% are exposed to any kind of virus, including Delta virus.
Right. And Dr. Das, over in the UK, as Professor Zhang has said, the Delta variant is the dominant strain there. It accounts for over 90% of cases in the UK. What can you tell us about the current COVID-19 situation there?
Sure, absolutely. So what we see, as Professor was saying, the Delta variant first identified in India is now the main type of coronavirus in UK, and it is making up more than 90% of all cases. We observe that Delta variant spreads faster than Alpha variant, which was first discovered in Kent, UK. Currently in UK, we have more than 1,600 confirmed cases of coronavirus just as yesterday. And these are the highest total for more than 4 months. And these numbers is what we observed in mid-February, which is of concern now. The hospitalization rate has steadily been increasing, with nearly 1,500 patients currently in hospitals. And we observe a regional effect. We see that, what from the data that previously London was the most affected, but we also currently with Delta variant see that the northwest of England is now getting affected. And the R number, which is very important in pandemic terms, which is the average number of people an infected person will pass the disease to, seems to be quite high. It ranges between 1.2 to 1.5 in most areas of UK. And vaccines are working very well, as the professor said. A single dose reduces a person's chances of catching coronavirus and hospitalization by 75%, and 2 doses will reduce it by 90%. So we have some hope.
Right, that is good to know. Dr. Das, meanwhile, against the backdrop of the Delta variant, news of the Delta variant, that is news of the Delta Plus variant. Now, what do we know so far about this latest strain?
So Delta Plus variant is a modification of the highly transmissible Delta variant. Delta variant has had multiple mutations, but in Delta Plus variant, one particular mutation called the K417N is the most important to understand. And this mutation is responsible for making the spike protein in the virus bind more tightly to human cells. The worry at this stage is it may be linked to the ability of escaping immune response, and the evidence is suggesting that may be partially resistant to vaccines and to the immunity gained from the previous COVID infection. This is at this stage quite worrying. And currently, Public Health England has confirmed that, of the 75,000 Delta cases sequenced, 41 has been identified as Delta Plus in England. And with Delta variant, we have had 42 deaths so far, of which 23 were not vaccinated, 7 died more than 21 days after the first vaccine, and 12 died more than 2 weeks after their second dose. So this is of concern for us. And with the Delta Plus, because there are so few cases, we know very little about how fast the variant will spread or the severity of the disease it's causing or how much it evades the immunity.
I see. Meanwhile, Professor Chung, here in Korea, the Delta variant was first confirmed 2 months ago. And as of this week, that is with regard to the briefing we had this afternoon, Chung Kyung talked about having 190 cases here in Korea. What are your thoughts on the spread of the Delta variant on the local front?
It will become a threat, but so far we are under control of Delta variants because it only comprises 8.5% of whole variants here in Korea, the most dominant one being Alpha variant, over 90%. And total, among the total isolation, only 1.9% is Delta variant recently. So that is quite a contrast to other countries like more than 90% isolation like UK and other countries. But if we delay the vaccination or if we ease the social distancing without a very definitive regulation, then we'll be also end up with facing a threatening under Delta virus. But still, we have, among the 190 cases, we have found those Delta variants from the entrance from abroad. So the quarantine period, we have detected 80% of all whole Delta variants. Only 20% was found in the community. So if there is no silent spreading in some society, still we have a very strict control over Delta variant so far.
Right. Dr. Das, what are some of the symptoms that can be linked to the Delta variant?
So as far we know, the classic signs of coronavirus is loss of smell or taste, a new persistent cough, and a fever. However, data collected via the symptom study app here in UK is suggesting that a headache, sore throat, or runny nose, in fact sneezing, unexpected sneezing, are also now thought to be symptoms of the virus. And it is being recommended now to the young population that if you feel like a bad cold, because it is such a highly transmissible variant, that if you do feel slightly funny, you should get yourself tested. And government is really advising testing regularly to control this variant at the moment.
Right, that is good to know, of course. Professor Zhang, you mentioned this earlier, but what more can you tell us about the impact of our current vaccines against the Delta variant?
Well, as Dr. mentioned, the first shot, either with AstraZeneca or Pfizer, could prevent 33% of Delta virus infection. That's a bit disappointing, but if you complete the 2 shots with AstraZeneca, is upgraded by as of 60%. Still not very high, but if you complete with Pfizer, that is 88%. Those are symptomatic Delta variant patients in prevention. But if you look at the hospitalization with Delta variants, there is a very severe case. Then the AstraZeneca can prevent 92% of hospitalization. That's a very good news. And Pfizer, 96%. That's just one study, but it's quite promising. Even though you have a symptomatic disease, COVID-19, then you don't need to get admitted due to a very severe disease. That's nice story. So I think current vaccines like AstraZeneca or Pfizer works, but we do not have any data with other vaccines. Like WHO accepted several other vaccines like Janssen, Moderna, Sinovac, and etc. But there's no data on that. Hopefully, we hope that those vaccines will work as well in Delta variants. But the thing is, the Delta variant escaped a bit antibody response. Then we'll see another variants. We named according to a Greek alphabet, alpha, beta, gamma, delta. Maybe in omega or phi, they will completely detour our defense system, either by made natural antibody or either by made vaccination system. So it's quite worrisome.
Right, the future is looking a bit bleak there. Dr. Das, what is your stance on the adoption of booster shots amid the growing presence of variants?
So the nature of any future booster shots will very much depend on the features of those variants, as Professor was just mentioning. And in that sense, we'll always be half a step behind the virus. Of course, the current vaccine will be adequate, but we don't know that yet. In fact, in UK, we have recently initiated one of the first studies evaluating COVID-19 vaccine booster shots. The study will also look at how to mix the vaccines types. For example, if you have had 2 doses of AstraZeneca, maybe a Pfizer would boost your immunity further. And regardless, I support the principle of vaccine as long as it is necessary. We know that vaccines are the only way out of such pandemic alongside basic infection control measures, which is good hygiene, remote working, mask wearing, ventilation, not going out and mixing with people at this stage, and avoiding unnecessary flying for sure. And we know we have heard all of this before in the last 18 months, but we know that they work. So let's continue doing that.
Right, let's do that. Professor Zhang, we've talked about this when you were here last time, but then what are your thoughts again on the idea of cross-inoculations to better deal with the presence of variants?
I have no idea actually, because there is no study on that. But the Korean policy is AstraZeneca first, and second should be followed by a Pfizer rather than AstraZeneca because of shortage of AstraZeneca, not because of covering variants and etc. But as I said before, the Pfizer seems to be better protecting Delta variants rather than AstraZeneca. The statistics say. So if you get AstraZeneca and followed by AstraZeneca again, you can prevent 60% of symptomatic COVID-19. And when you have a Pfizer and Pfizer, you can prevent 88%. And you have a AstraZeneca followed by a Pfizer, that could be in between 6% and 88%, not bad. So around 70% will be okay. And anyhow, as I said before, you can prevent hospitalization, either AstraZeneca or Pfizer. So I think that's not a bad idea to have a cross immunization, even though it is because of shortage problem.
Right. And what is the stance over in the UK, Dr. Das? How do you respond to the adoption of cross-inoculations against COVID-19?
So as I just mentioned, we are looking at, cross mixing and matching the vaccines. And as the professor just explained, there is a lot of unknowns at the moment. We don't have a very clear data of how this will happen. We are waiting for this almost study to give us some first information about mixing these vaccines. What we do know is that, the immunization seems to have, sort of with the mix and match of vaccines seems to have been better. Of course, vaccines are going to be covering quite a bit of protection. They are not 100% though, so we really in future will be looking at more basic public health measures and not just depend on the vaccine. So at the moment, the stand is that with the variants, we don't know what's going to happen in future, but we are very optimistic that what we see with the current vaccination is going to be very positive in future as well.
Right, hopefully. Professor Zhang, what are your words of caution then for the general public as authorities around the world, including here in the country, seek to keep variants at bay?
Keep variants. Wow.
I know it's a tough question.
Yeah. Because if you don't have immunity to a wild type current virus, then you have any chance to have a virus, then you yourself can make a variant in your body. So that's, and in some patients who have already a natural antibody, then you are infected with some other virus, then the virus can mutate in your body to making another variant. So the best way to prevent the variants from developing is get all people immunized. And if you have any certain kind of antibody in your body, then the virus cannot work in your body, cannot even invade your body. So the best way is to get the vaccine as fast as possible, because all the vaccines approved by governments are very effective and has a high efficacy.
Right, again, the importance of vaccination then. And Dr. Das, what are your thoughts on the importance of vaccinations as we face this new battle with variants?
Very, very important. And you know that UK at the moment ranks markedly higher than other European countries when it comes to willingness to receive the COVID vaccine. And based on the surveys we are conducting here in UK, we see that adults, especially in England, are more than 9 out of 10, 93% adults report positive sentiments towards the vaccine, which is great news. 7% of adults do report vaccine hesitancy, and we see this varying according to the age group. But the survey has also given us some ideas that the top 3 reasons for hesitancy is long-term effects on the health, side effects of the vaccine, and how well the vaccine works. And once you have answered these questions, we notice that the hesitancy is still reduced. With the vaccine program progressing at the moment, you can see that the vaccine hesitancy is also decreasing, which is great news, which is what we wanted. UK is trying to cover 80% of adult population by the 19th of July, which is the opening date for us, finishing all the lockdowns. And it looks very much achievable at this stage. And several measures have actually helped the UK. And the most significant would be the role of National Health Services here, NHS, which is highly trusted in UK. The public health messaging, it has been targeted and using data to provide vaccine efficacy and lower risk of significant side effects, which has all been mentioned beforehand. And we are here to provide answers to any of the questions people have about vaccination. And I think greater community engagement on vaccines with the ethnic minorities is also helping here.
Right.
And the group with higher level of hesitancy is starting to decrease now.
Right, that is good to know, of course. All right, Dr. Das, as always, thank you very much for your thoughts and your time at this very early hour. And Professor Zhang here in the studio, thank you very much for being with us in person.
Thank you.
Right.
Thank you.
As of now, then, our weapons against COVID-19 are vaccines, face masks, proper hygiene and social distancing. And as our one medical expert that is in our studio earlier said, it's not over until it's over. Thank you for watching.